If your doctor seems happier these days, there's a good reason. A new path to health care is on the horizon, and our next guest says it involves doing away with much of Obamacare. Fox News Medical A-Team's Dr. Marc Siegel joins us now to explain. Good morning, Dr. Siegel.
Great to see you.
Great to see you, too. All right, so you wrote an article in the Wall Street Journal talking about what needs to happen, what needs to improve with Obamacare. What's wrong with Obamacare? Let's go through what you talk about in the article. The first thing you say is hidden deductibles. What do you mean?
Well, because patients come to the office, Ainsley, and they have very high expectations. They're paying this high premium. We've been hearing about all premiums going up, and they think everything's going to be paid for. But then they may find out that their blood test or their EKG is not actually covered, and the deductible kicks in. They didn't know about it, or they didn't hear about it properly. So that's the first problem.
All right. What about your next one problem you say is narrow networks? What does that mean?
Well, and then there again, this is not very doctor-friendly. I'm there as a gatekeeper, and I'm trying to send my patient to the top orthopedist or to the top cardiologist, and I find out the person I usually use isn't in the Obamacare network. So I'm struggling with a list, and on it are names I've never seen. That can't work. It spends way too much time. Instead of talking about the medical problems, I'm worried about where to send the patient for referrals.
All right. You talk about high expectations and high premiums. What do you mean?
Well, again, the high premiums make people think that everything's going to be covered. Comprehensive, you know, bells and whistles. President Obama says it's all going to be covered going in. Maternity care, which makes a lot of sense. But some of the other things that are covered are what's leading to the skyrocketing premiums, plus insurers dropping out, plus the fact that those up to the age of 26 and over, 27, 28, 29, are saying, I'm healthy. I don't want health insurance. I'm going to wait until I'm sick.
All right, so what do you think needs to be done? You talk about repealing it. You definitely want to repeal. What does that entail?
Well, again, I think that Obamacare is bleeding onto the healthcare system, that even the employer-based model is being affected. I think we have to scale back this insurance that's very low quality but very high expectation. It's got to be replaced with the following thing: catastrophic style insurance, insurance with high deductibles but where you don't pay a high premium, and then if you have a pre-existing condition and you're really sick, you're in a high-risk pool which is government subsidized. You know that right now there's $40 billion in government subsidies for Obamacare to cover those 20 million. The exchanges are not working. Almost the entire exchange is one big subsidy. Let's change the subsidies to cover those who are really ill.
Health savings accounts.
I want all premiums to be tax deductible, all premiums. I want the health savings account, as President-elect Trump says, to be expanded. Let them be something you can take from year to year, from patient to patient. Someone else in your family could use it, Ainsley. If you're not using it, your brother, your sister, your child, your husband can use it. If you, God forbid, you pass away, the next generation gets your health savings account. You build it up over a lifetime. And transparency of prices, where I can tell my patients, hey, here's what that MRI costs. You're paying for it out of pocket. Here's the best place to go in town to get the cheapest bang for the buck. We don't know what we're paying for. Insurance hides it. We don't know what the cost is.
Lastly, you talk about keeping costs under control with less government regulation.
It's all about government regulation, excess government regulation. We're not allowed to have ambulatory surgical centers except right by hospitals. There's a million regulations with Obamacare. Scale them back. Let the states be much more involved. Medicaid should be state-run, and Obamacare restrictions and regulations are what's driving up costs. I want to get back to the day when it was the doctor and the patient. Patient sat in front of you. Doctor said, here's what you do. Patient and doctor conversation. Get the insurance company out of the room and the government out of the room.
I think most of our viewers would agree with you. Thank you, Dr. Siegel.
Great to see you.